wait on my smiling face. It's usually what he says. All right, good evening, everyone. Want to welcome you to the Caldwell County Board of Health meeting, June 3rd, 2021. Welcome those who are in attendance in our audience, as well as joining us by TV, and certainly our Zoom-in members. And so welcome all you folks. I'm looking over there, but you're seeing me from here, so I'll say hey, and appreciate you folks being here. Can we hear you, Dr. Davis?
Yes.
Oh, I did hear him. Okay. I was just trying to do a sound check to make sure I could hear everyone. So again, we appreciate you folks being in attendance this evening. We have a quorum, it appears. And so we're going to proceed with our meeting and agenda. And our first item is our invocation, and I'm going to ask Dr. Davis if he would lead us in that, and then we'll do our Pledge of Allegiance, and I'll ask the Honorable Wayne Rash here to help me with that as we enter into our Pledge of Allegiance. So if you would, Dr. Davis, lead us in our invocation, please.
I'd be happy to. Would you bow your heads with me, please? O holy and mighty God, we sing your praise. Remind us now not to criticize or complain, those sister sins that are easily entangling us when we are dissatisfied. We thank you for the devotion, the dedication, and the diligence the health department staff have given to their jobs during the past pandemic year. Help us to preserve and improve the health for all of the citizens here in Caldwell County, and guide us with your wisdom as we conduct this meeting tonight. In Jesus' name we pray.
Amen.
Amen.
Attention, salute, pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Liberty and justice for all.
All right. Thank you, everyone. We live in the greatest country in the world, and I'm appreciative of that. Any announcements this evening from our health director?
Just a couple. I just wanted to mention we're finally at the point where we're able to move our COVID-19 vaccine pods to our first floor. So we're closing our third floor vaccine pods and opening up areas in our building. So we're trying to get back to somewhat of a new normal. I was talking to Jeannie, and it's a little bittersweet, kind of closing everything down, but we're so thankful that COVID's finally kind of coming to somewhat of a close and able to get back to what we're able to do. I do want to thank all the staff for what they've done with COVID. Everybody's worked super hard, and we're very proud of them. Next, I just want to kind of mention a little bit about environmental health. There's not going to be a report tonight, and I believe Libby's going to mention that in a second. However, I do want the board to be aware of increased permits. This is on-site, causing increased backlog. Environmental health has found ways to decrease the backlog by asking for more positions and looking at outside sources for assistance. We hope to get this issue corrected as soon as possible. I just wanted the board to kind of be aware. That's what Adam was going to talk about tonight. He'll go more in depth in our August meeting.
All right. Has anybody on our board been getting questions about environmental health or anything we could enlighten you on there? When Anna mentions on-site, she's speaking specifically to septic tank permits and getting ground tested and perked and permits issued, and we have a pretty extensive backlog there, running now, I think, about 6 months behind.
They're getting in January.
And so we have moved in many directions with the county, through the commissioners, and as she mentioned, adding some staff there. And we're really excited to find an outside vendor and agency, if you will, that we're going to be able to contract with. It's going to come in and help us to get some of those permits caught up. Just going off my memory, we're about 350 permits behind. And so this company and vendor we're looking at can come in and possibly in a 10-week period help us to get about 100 plus permits knocked out. And we're hopeful that they're going to be helping us get to that point that we can catch back up. So I just wanted to make you aware of that, as well as our citizens that tune into this meeting, to know that we have an issue and we're addressing it as diligently as we know how to try to expedite this. Because if somebody's got a bank loan and trying to build a home, we're holding them up until we can get the property perk tested and a septic permit issued. So that's the big push now. So with that, Libby, do we have any amendments to our agenda?
Just the one under public health update, Adam will not be presenting tonight.
So our environmental health report will not take place this evening by Adam. And remember him in your prayers and thoughts. He's had a death in the family, and he is there as he should be with his family. So that's the reason he was unable to be with us this evening. So with that agenda amendment, do I hear a motion that we adopt this evening's agenda?
So moved. Second.
All right, so we have a motion and a second. All in favor signify by saying aye. Aye.
Aye.
Any opposed? And that motion carries unanimously. And our first item is our approval of the May 6th meeting notes. And I trust and hope you've had an opportunity to review those. And if you have, do I hear a motion that we adopt those minutes for our May 6th meeting?
So moved.
Second.
And a second?
Second.
All right. And let me say, that helps us if you do wave. That way Libby can capture who's making a motion and who's seconding. So, but all in favor signify by saying aye. Aye.
Aye.
All right. Any opposed? And that motion carries as well. So our first item is our financial report, Miss Jeannie Walker.
Good evening, everyone. Our budget summary for the month ending of April, we've expended 65% of our budget and received 83% of our revenue. Any questions?
Pretty straightforward.
Yes. Way I like it.
Everything's running as it should.
Yes, yes.
Very well. Anybody have any questions or anything of our budget report? Hearing none, I'll ask, well, I don't guess, is there any amendments?
No, we do not have any budget amendments tonight.
So no budget amendments, so therefore there's no action on that to take place. And so we'll just move to our next item on our agenda, which is a COVID vaccine update.
Yes.
Jeannie Walker.
As Anna mentioned, we've closed down our vaccine pods. We had 4 pods initially that were running to get out the COVID vaccines, because we were averaging anywhere from 150 to 400 vaccines a day. As most of you are probably aware, the demand has decreased significantly, so we're able to kind of close down those pods, and so we're doing vaccines through the clinic now. We still encourage people to make appointments, but we do have walk-ins, so if people want to come in to get their vaccine without an appointment, we will take them. To date, we have administered 12,847 vaccines. We do offer Pfizer, especially with the changes now for adolescents, so we're doing those on Wednesdays. So if anybody has adolescents who want to get the vaccine, they can come on Wednesdays to get those. And as I mentioned, we are doing walk-ins. So any questions?
And I know I'm putting you on the spot, but does that number, the 12,000, that's everybody in Caldwell County?
That's not the whole county. That's just what the health department's.
Okay,
has
so do
administered,
we
yeah.
have any idea how many in the county has been
I
vaccinated?
think it's about 40,000. 40,000 vaccines. So probably
ma'am.
roughly around 20,000 people, about a
Okay.
fourth of the population.
All right.
Yeah.
So our percentages is probably, and somewhere I remember seeing a 30 or 31%.
Yeah, I think
Vaccinated
I think
rate
we're
in
about
our
a
county.
fourth of the population.
Okay.
And that's just kind of off the cuff, so,
Right, yes,
yeah.
ma'am. Well, it's good and that many people have, and certainly we've seen the the spread of it, but it is still there.
Right.
And I think I saw a report this week where we had another recorded death or two from the COVID. So people are still dying,
Right.
which is caused enough to cause a person to want to come get a vaccine to keep from dying. And it's just plain and simple. So it's highly recommended.
Right. And I think statewide, they've seen a decrease too, because they've changed the way we order our vaccines allocations. We're kind of partnering with other counties. For counties that have excess vaccine, we're getting vaccine from them instead of it coming directly from the state.
Right. And I'm seeing as well, and you may be going to cover this, but a lot of incentives are now being pushed forward to incentivize people to get a vaccine. And I've seen something on our state legislators are looking at something in that line. And then I know a lot of employers are. And my employer, as a matter of fact, has incentivized and giving cash gift card to anybody that gets their vaccine. And
That's something that we're looking into. I approached it with the county earlier this week. So that's something that we can definitely look more into and hopefully be able to do something.
right.
I know a lot of counties are doing some pilot programs with some incentives, some of the larger counties. And
Right.
So,
And maybe that's where I picked that up and seeing some of that too, because it does seem like Mecklenburg County maybe mentioned.
yeah, I think they are one of the pilot
incentivizing.
counties. They are.
So, but if there's any way we could, we certainly would, I'm
Yeah.
sure. So, okay,
And I just want to commend all the staff. They have been tremendous in getting vaccines out and working together. They've worked really well as a team. So we've been really proud of all the staff.
yes, ma'am. And I'm sure our entire board would echo that as well. And to think that that our department, our health department administered over 12,000, almost 13,000 vaccines to date, that's a lot.
Yeah.
That's a lot of needles in arms.
Yes. Yes.
So, but we appreciate everything everybody done.
Any other questions?
Anybody from our Zoom meeting have a question or comment about vaccines? All right,
Okay. Thank you.
thank you. I see that Ms. Hoover is not here.
She's on Zoom.
She's on Zoom?
Yes,
Where is she?
there she
There she
is.
is.
I don't know that I like y'all stalking like that. So, events, Miss Taylor Hoover, welcome.
Thank you so much, Randy. I am here with you today. Some community events updates, just to let you know what we've been involved in with the community.
All right.
Give me just 1 second to share my screen. Okay, you may not be able to see whatever I'm seeing, but I can just go over briefly what we've done. So we did our Child Health and Safety Fair. You may be aware of this. So this is a big community event that we do every year. So it really targets children between the ages of 0 to 5, and it focuses on child development. So this year was our 3rd annual. But it was the first time that we did a drive-through event. So we weren't able to do it last year, unfortunately, because of COVID, but we were able to do a drive-through event this year, and we saw it as a big success. We gave out a bunch of health information and prizes, goodie bags, and a lot more. So we had a bunch of different vendors represented. So we had Smart Start, local police departments, the fire department, the library, Caldwell preschools, EMS, Robin's Nest, of course the health department, DSS, RHA. So in total we had 24 different vendors. We had about 53 families that we served and roughly about 200 children. And so looking back at previous years, this was a little bit less, but considering this was the first time we did a drive-through event, we considered that like really good numbers for us. So another event that we did this year was called the Child Find event. So this was also focused on like child development and young children. So this was hosted by the Family Resource Center in collaboration with Lenoir Housing Authority. This was hosted at the Early College. So this was the first event that they've ever had. So it was smaller, but they did serve over 25 families, and there were about 50 children that were there. But we did have a good representation from the health department there. So we had Safe Kids with injury prevention. We had WIC there, as well as the dental clinic and child health. So really these are the only two events that we've done so far. Typically the event season is, in the spring and the summer. But we really hope to get out there and involved more this summer. So if you know of any events, we're happy to get our name out there and positively promote the health department. So hoping to get back out there, back to a new normal, because that's a fun part of our job.
All right. Well, thank you. Anything else to add, or anybody have a question of Ms. Hoover? All right. Hearing none, we thank you for your attendance and your report.
Thank you.
Next is our Medicaid Transformation, Libby Clark. I'll get it out, Libby.
That's all right. Good afternoon. I'm here to talk about Medicaid Transformation. As you know, for many years now, they've been talking about it, roll it out a little bit and take it back. And in 2015, the General Assembly directed the HHS to go from a fee-for-service model to managed care model, where the whole person is treated. If there's a need for food, then we're going to do a referral for food or housing or whatever it be. We will go live July 1. There are 5 different prepaid health plans: Blue E, which is Blue Cross Blue Shield, United Healthcare, WellCare, Carolina Complete Healthcare, and AmeriHealth Caritas. And the participants can choose from one of the 5 programs. They all have their own incentives and perks and standards that they go by. Anything that was covered by Medicaid prior to this will be covered now. The only difference is it's going to be managed care instead of just, if you're there for a physical and they never ask about food or whatever, we'll start asking about your family life and your needs and your own life and your families. If the patient or the resident did not choose by May 14th and they extended that another week because of COVID, a Medicaid broker will choose for them according to their medical history. If they've been going somewhere, they'll look back at those records and they'll assign them to that provider, providing that they signed up with these 5 prepaid health plans, and we did at the health department, signed up with all 5. Dental will not be covered under these insurances, but they will still keep their Medicaid, straight Medicaid for that, even though everything else will be covered under the insurance. So nothing really is going to change as far as services. It's just the way we get paid will change a little bit. We do have care managers on staff now in women's health and child health, and we have contracted with CCPN to cover the care management piece for any other program areas that do not have care managers on staff. If anybody that's listening has questions or concerns, they can go to the website of ncdhhs.gov, and there's wealth of information on there. Any questions?
Right. Yeah, that's been I don't know how many years they've talked about Medicaid
Years and
Transformation, so.
But I think it's coming this time. I don't think they're going to
Yeah, I
change.
mean, I think they will do something.
I don't think it's a good change. I
Yeah.
think it's a good change for the patients. If you look at the incentives and the perks of each plan,
Right,
they're all 5 really, really good plans,
yeah.
so.
All right, well, thank
Thank
you.
you.
Thank you.
Next is our Board of Health Operating Procedures Review. Miss Anna Martin's going to lead us in a discussion.
All right, so in your packets, you should have received the Board of Health operating procedures. I'll just mention something quick. They are the same, nothing has changed since last year except for underneath attendance. It does mention a stipend. So it says a stipend may be offered to the board members on a monthly basis according to attendance. Stipends will be given in December and June of each year. The board members may opt to decline receiving the stipend if they so choose. We added that this year after discussion, I believe at our budget meeting and even last year. So we went ahead and added that in our operating procedures. And so I will be getting with Libby to figure out what that will look like and our finance officer. However, if you choose not to take a stipend, we will have you to fill out this form. And I believe everybody will get the form anyway, because if you would like the stipend, you have to do it direct deposit. Is that correct, Libby? And at the bottom, if you do not want it, you just choose, I would not like to have the stipend. So.
All right. And just to highlight, that came out of some discussion because we're certainly going to be moving back toward in-person meetings, and there is a cost that is incurred for each member who attends a meeting, having to come from wherever they reside into a meeting place. And so we had that several years ago, and through some budget attritions and various things, it went away because several of the board members felt that they didn't need that, but we wanted to have it as an option, to give each board member an option. So you'll be receiving that information, and you can choose to accept or not. But at least it's a token, if you will, of appreciation for willingness to serve and to be a part of a board, an important board such as this. So we have to have action on adopting these operating procedures. So I'll make a motion that we adopt these operating procedures as has been presented by our health director this evening. Do I hear a second?
I'll second.
Dr. McBurney seconds. So any other discussion or comment? All in favor say aye.
Aye.
Any opposed? Hearing none opposed, that carries unanimously. So again, we appreciate your time in that and appreciate our staff preparing that. And I would assume that certainly goes along annually. We have to do that to meet our health certifications and all the things that we're staying in line with. All right, so next is on our agenda is recognition of outgoing board member, and Sherry Reichling has declined to serve any further on our board, and so we have a certificate and recognition of her time and efforts that she had on the board. And so I'm just making that announcement that she's going to be leaving our board. And if you get an opportunity or see Sherry, thank her for her service to the board. And we appreciate all that everyone does, but we will miss her. And so, which brings me to an announcement, I guess, a public service announcement for anybody that hears this. We're routinely looking for people to serve on our boards and commissions in Caldwell County. So if you have a desire to serve in a capacity like that, reach out to our county clerk, Mr. Thomas Welch, and he can get an application in your hands, and we would then get you seated on a board of your choice if you would like to serve in one of our boards in the county. And certainly we appreciate all the help that we get from folks serving, and this board especially, with the health of our county. Anything else needs to be said there? Mr. Vice Chairman?
Great job.
All right. Next is our meeting location, and I think in speaking with Anna, we would like to resume now our in-person meetings for those who would want to attend. We will still have the option for Zoom if you would prefer to Zoom, and if it's more convenient for you to do that. We want to have that as an option, but with the reduction in our numbers of COVID and vaccinations, and all of us having received our vaccination with the new CDC guidelines and various things, we feel that we can move toward having an in-person meeting like we once did. It seems like so long ago, but it was just a year, 18 months ago that we had to stop meeting together. But our next meeting would be when and where? I didn't write it down.
Should be August. Libby's got it here.
So it'll be, we won't have a month, in the month of July, we will not have a meeting because that usually
August
falls
5th.
in the July 4th week. So it'll be the first Thursday night in August,
August 5th.
August 5th. And we will meet here in the city county chambers for those members that would like to attend at 6 p.m. And again, we'll provide a Zoom link for you to be able to Zoom in if that suits you better. So, but we look forward to seeing all those who can come and be a part of our meeting. Anybody of the group have anything else you want to say or add this evening? Everybody's all quiet. Must have had a busy Memorial Day weekend trying to recover. All right. Well, with that, we have reached the end of our agenda. So again, I'll thank you for being here, board, and being in attendance, and I'll entertain a motion that we adjourn.
I move that we adjourn the June meeting of the Caldwell County Board of Health.
All right, do I hear Dr. McBurner second? So all in favor say aye. Aye.
Aye.
And waving goodbye. We'll see you next time. So thank you and have a good evening. This meeting is adjourned.